Hello everyone, today we are going to talk about the dirty work topic. This presentation will be made by Carl, May, Dami, Ayushi, and Kuzie. Next, I'm going to talk about a brief introduction. Dirty work could be defined as some tasks or jobs that could be perceived as disgusting or degrading. The fact that dirtiness is not necessarily inherent to the work itself, but is perceived as such according to subjective standards of cleanliness and purity. Dirty work could always be understood from three dimensions. There are physically disgusting, socially degradation, and moral conceptions. At most of time, the extent of dirty work could be calculated by the depth and breadth. Breadth means the proportion of the work that is dirt. A physician has a less dirty breath than a mortician, because the latter always deals with dead bodies. Depth means the extent to which a worker is directly involved with dirty work. For example, police have a higher intensity than the security guards because they mainly deal with criminals, while the latter mostly deal with the public. Moreover, dirty work could be defined by different cultural and social processes, varying from group to group, at different time periods, and across geographical spaces. Today, I will start by the first question: to what extent could dirty work be defined by disorder?
For this question, I think we should discuss about the relationship between dirty work and disorder first. Actually, according to what Douglas said, dirt is a byproduct of systematic ordering and a byproduct of classification of matters. So personally, dirt is more likely to be an inappropriate elements that are always be rejected in system. Basically, we can say this kind of dirty work is an essentially disorder because it damages the purity of pattern. For example, those legal activities are spiritually dirty work in real sense, which disorder the legal system and social order. So this dirty work can be definitely called disorder. Dirt is also a byproduct of classification of matter. Everyone have different standard of it. So some dirty work may not really dirty to some extent. Maybe just like work with some dirty things, like nurse work with blood, tears, stuff like that. It is more physically. But because of the wrong classification of that job, they may be put into a wrong position and to be defined as a dirty work as well. Some of you may confuse about this. For example, the food itself is not dirt, but if the food is put into the bed in the wrong position, environment, or improper situation, that is become real dirty. So does job. Nurse is to take care of patients, but because of the wrong definition or judgments from others, like nurse mean to do some dirty work no matter mentally or physically. They just like the basic workers in the hospital. And some of the doctors would like to distribute lots more needless work, even command them to do some immoral work, or something they should not to do. This is also one of the situations of disorder. And this kind of disorder is not only about the hospital system like nurse deviate from their real job, and those needless jobs increase their burden to make nurse become a real dirty work, but also involves the humanity ethics. Take my personal experience for example. I did a part-time job before called Miss Etiquette. We basically receive celebrities or businessmen for meeting and serve drinks or snack for them. But one or two of them, after business activity, will disturb us to ask pay for sex. Maybe we just need to stand all day originally to do some polite work, even it is hard. But now we even be seen as doing some dirty livelihood. I think it's a kind of disorder which messes up the reputation of this vocation. Even some secretary and marketers sleep with their boss for some interest or contract sometimes.
Actually, I totally agree with what May said. I just think of some arguments come up by Nightingale, who was the most well-known nurse in the world. She believed that nurses should have the right to pursue the right order of sanitary knowledge and a clean working context. They should not receive the harm caused by formal or informal administration or routines. Also, like May has just talked about, dirt was created by the differentiating activity of the mind, and it was a byproduct of the creation of order. Nurse, as an occupation, should have its own identity and worth. However, unfortunately, there are disordered behaviors happening around the nurses nowadays. In some cases, nurses are initially and routinely subordinated to the hierarchy of a hospital's bureaucracy and doctor's command. They are required to deal with some morally incorrect business, such as induced labors, stillborn and still-live babies under the insanitary conditions. That was imposed work that they should not have taken. In my opinion, nurse is an organized, practical, scientific training, and the purpose of which is to produce nurses who are servants of medicine, surgery, and hygiene. Although the nurse deals with death and blood every day, it is a physically dirty job with order. If external factors like administration and hierarchy appear, nurses are forced to do something out of order, which is socially dirty or even morally dirty. This kind of disorder makes nurses' work become the real dirty work. Those nurses not only work with and through dirt, but as transgressors of the usual occupational order, they are positioned as dirt. Nurses should not be treated like that anymore. In the future, nursing's relationship to dirt should be reworked, including occupational positions, recognitions, rewards, and opportunities. The most important thing for the nursing's reworking is to rebuild a normal order of nurse system. It should be classified clearly that what rights and responsibilities nurses have. Nurse is the white angel for us. They should not be treated as real dirty worker by disorder.
The next question we'll be looking at is there a way of resisting the stigma of dirty work? Hamilton states that the perception of certain occupations as dirty often serves to stigmatize those involved. This means that those doing such jobs are seen as dirty or foul, so much so that dirty workers are tainted with negative connotations. The concept of dirty work is not necessarily one that is restricted to occupations with low wages, such as domestic workers, prostitutes, or erotic dancers, but can also be seen in any form of work. Dirty work of some kind can be found in all occupations because at some point the worker is likely to have done something that undermines a sense of personal dignity or because the work involves some contact with a stigmatized group. As Carl stated earlier, dirty work can be seen under three main headings: physical taint, social taint, and moral taint. Physical taint is work associated with dirt or performed under dangerous conditions, such as refuse collectors or miners. Social taint is work involving regular contact with people from stigmatized groups, such as police officers or domestic workers. And moral taint is work regarded as sinful or dubious virtue, for example, debt collectors or prostitutes. The concept of dirty work can be temporally or culturally bounded, which varies from group to group and at any given point in time or across space. For example, the advancement in technology can lead to an arrangement of job typologies so that previously rejected occupations become newly accepted to some groups, or through economic circumstances where work may be avoided by indigenous workers as undesirable but can be taken up by migrant workers. Another way of resisting stigma of dirty work is through strong culture. The idea of a strong occupational culture is important in maintaining a positive identity within dirty work because it helps people to endure stigma as a group rather than as individuals. It can be said that people sharing common social pressures can come together and see themselves as being in the same boat. This shows that the culture of the organization is a result of how dirty workers differentiate themselves from others in order to build a defense mechanism against being stigmatized. Another way is through reframing, a process in which workers actively change the meaning of dirty work, which helps in making demeaning aspects of work more personal to the worker, thus giving the work some meaning to the worker. This is explained further later.
We have also attempted to answer this question from a managerial perspective and how managers can influence the stigma of dirty work or render it salient. Before answering this, we want to know the role of managers in an organization. According to Ashford and Kreiner, a manager's role deals with supervision and coordination because they are responsible for their subordinates. And we might wonder or question if managers are in the best position to counter this idea of dirty work because they are in most cases not the ones that carry out this dirty work. Hodges, however, suggests that managers are still doing some tainted work themselves and they are fixed with a dilemma of handling a taint whilst also being in a dirty work manager's role. This therefore renders their role more complex than those of frontline dirty workers. For example, a manager of an abortion clinic might be seen as a dirty worker because he supervises murder. Societal perceptions of dirtiness often foster three processes in dirty occupations that help occupational members avoid internalizing those perceptions. The first practice for countering this taint is a process called normalization. This process aims to render ordinary what the society views as seemingly extraordinary. And this, in turn, enables dirty workers perform their tasks without burden of stigma. Secondly, managers can resist the stigma of dirty work in an organization by developing occupational ideologies. Ashford and Kreiner also suggested that a strong occupational stigma motivates occupation members to develop ideologies that confer more statutory meanings on their work in three ways. Firstly, reframing. This infuses the work with positive values and negates its negative values. For example, the job of a charity worker who might be seen to come in contact with some form of dirt might be infused with some positive values, such as the fulfillment that they know they are working towards a good cause. Secondly, recalibrating. This adjusts the implicit standards that are used to evaluate how much or how good the tainted components of a job are. Thirdly, refocusing. This shifts attention from the tainted aspect of an occupation to the non-tainted aspect. Another way managers can reduce this stigma is by societal weighting. This occurs when dirty workers differentiate among types of outsiders. They condemn those that condemn them and support those that support them. This can in a way be seen as a defensive tactic that helps them engage in selective social comparison to draw flattering inferences about themselves. For example, call girls feel superior to street girls. From an anecdotal viewpoint, as Ayushi mentioned earlier, the stigma attached to dirty work would be best tackled or restricted by the individual worker themselves. If an individual appreciates their job and associates it with positive identity and are not bothered about what the society feels, then automatically they don't associate their jobs as being stigmatized.
So I'll be looking at the final part of the presentation. I'll start by highlighting the question, how do your experiences show work being defined as being dirty? Before I answer the question, I'll refer to a definition of views on what dirty work is. Now this has already been discussed by my colleagues, but dirty work is any job that is considered taint. Now there are three classifications of these jobs. Firstly, we've got physically dirty work, which are jobs like street cleaners, plumbers, and rubbish pickers. Then you go on to socially dirty work, which are examples of sex workers, rubbish pickers, and morgue workers. Lastly, you've got morally dirty work, that's sex workers and lawyers. At this point, you may note that some jobs have more than one classification of being dirty. Now, just to give an evaluation, a critique, and personal experience, I'll start by giving a critique or a counter-argument to this. I feel that what ultimately defines work as being dirty is how the individual feels about the job they are doing. Therefore, how the individual feels about the job they're doing or how it affects their identity is what ultimately defines dirty work. I say this because, as explained by the girls who present before me, there are ways of avoiding the stigma associated with dirty work. Say, the example of sex workers, they feel their job is morally dirty when they're in a society which points fingers at them. They do feel comfortable, however, when in the place of work, surrounded by people doing the same job. Last, to illustrate this a bit further, I'll give a bit of personal experience. I'll use an example of one of my friends who works in a care home for the elderly. The job requires them to clean up after people who sometimes mess themselves up or involve changing people with limited mobility. Now, this is hard for me to think about and seems a job almost unbearable to do, but she enjoys doing the job. She feels it's very fulfilling and comes natural to her, as she considers herself to be a naturer. Therefore, she does not consider the job to be dirty, although physically and socially, a majority of people would consider it to be. Just to give another end of the spectrum, I'll give an example from my experience working as a retail associate. Now, we've got cleaners coming in every morning, and they do not, because of the job they're doing, they do not want to be associated with the rest of the staff. They feel their job is a bit of low, it's got a lower prestige to everyone else, and therefore, even if a customer was to walk up to them with a question, they'll try and avoid it. These two examples show how the individual's identity affects the job they're doing based on what dirty